Hello from Jonathan and from me. Welcome to the programme.
First tonight, the damning report highlighting a catalogue of serious failings in our out-of-hours GP service.
The health watchdog today revealed the findings of its investigation into the events that led to a German locum giving Cambridgeshire pensioner David Gray a fatal overdose.
It criticised those responsible, saying a series of warnings weren't heeded. Health Secretary Andrew Lansley has also condemned what happened, as Emma Baker now reports.
It is the most damning verdict yet on the death of David Gray, a death that could have been prevented had private company Take Care Now addressed systematic problems in their out-of-hours service. Today, a report by the Care Quality Commission highlights a string of serious failings.
Well, I think the report indicates that Take Care Now did very little to learn from past incidents. The staffing levels were inadequate, shifts weren't often filled, they reported information incorrectly to the primary care trusts that bought services from them.
It was February 2008 when Daniel Ubani gave a fatal dose of diamorphine to David Gray at his home in Mainey in Cambridgeshire. It was the doctor's first shift working as a locum in England. But it wasn't the first time such a mistake had happened. Today's report highlights two incidents in Suffolk in 2007, where other German doctors had also administered huge overdoses of the same drug. Both patients survived, yet neither incident was properly investigated. A senior doctor at Take Care Now warned there is a systematic problem. If we do not address this, it's only a matter of time before a patient is killed.
Tragically, he was absolutely right. A month later, my father was dead, and the board at TCN failed to act on that email, and they must bear a huge responsibility for this. I don't know how they can sleep at night.
Last month, Stuart Gray travelled to Germany to confront the doctor with his brother Rory.
I want to listen to what he has to say. What have you got to say?
Since their visit, Daniel Ubani is now trying to take legal action against one of the brothers. Yesterday, Rory Gray received this letter in the post from Ubani's lawyers, threatening court action for infringing Daniel Ubani's personal rights. This from the man who is allowed to continue practising as a doctor in Germany despite having killed their father. Now the Greys have highlighted Ubani's past in his home country. The doctor will face a disciplinary hearing with German medical authorities. Today's report also criticised the primary care trusts, saying they did not monitor performance adequately.
They didn't actually even monitor the contract. They didn't know what the quality of service was that should be provided. They didn't challenge the company concerned about the quality of service being provided. It was really a lamentable failure on the part of those responsible for commissioning this service.
Since David Gray's death, Take Care Now has been bought out by another company. And NHS Cambridgeshire says it has implemented a number of changes to prevent such a death ever happening again. Emma Baker, Anglia News, Cambridge.
Well, a damning report and some pretty damning words there from the Health Secretary Andrew Lansley for NHS Cambridgeshire, who Mr Lansley said, having appointed Take Care Now, failed completely to monitor their performance, a point I put to the Chief Executive of NHS Cambridgeshire, Dr Paul Zollinger-Reid.
That's correct. The report's fairly clear. None of the PCTs adequately monitored this contract. It's also important to recognise that TCN also had several serious untoward incidents with controlled drugs that they didn't report through. So we had a series of issues, the PCTs not being rigorous enough and TCN not putting the information through. We also had local GPs increasingly saying that they weren't satisfied, and we listened to that and we undertook action.
But you didn't at
and
the
we
time,
now have
did
those
you?
GPs running the service.
But you didn't at the time, and that's the important point.
No, the important point for me, and I've admitted that mistakes were made. That's clear, that's obvious from the report. The important point is to stand here today and reassure the public we have a safe service because of those reasons, because we do unannounced checks, because we do rigorously monitor, and because we have local competent GPs. Could Dr Ubani work here today? No.
But just tell me this, why should the public have any confidence in you at all when you've shown yourself incapable of responding to repeated warnings?
Because we have now undertaken those radical changes. As I said, TCN didn't pass on a lot of that information, but I'm not hiding behind that. We clearly made mistakes. We let Mr. Gray down, and I apologise unreservedly to his family. We have learnt those very painful lessons, and we now have a very safe service.
Now, when I last interviewed you, I asked you if you might want to consider your own position. After today's report, have you changed your mind?
I joined this organisation in January of this year, and this episode happened about 2 years previous to that. This is a wide-ranging and systematic failure. One individual is not to blame for this, and it will be very easy to blame one individual. We have looked and we have understood what happened, and we have put in place changes.
Dr. Zollinger-Reid, thank you very much indeed for your time and joining us in Anglia tonight.
We already know that school rebuilding plans have been scrapped, and now parents in some parts of our region say that spending cuts have left their children's education in limbo.
A fortnight ago, Bedford Borough Council put on hold plans to phase out middle schools. Suffolk's also committed to getting rid of theirs, but has delayed the axe for some because there might not be enough money to upgrade senior schools.
The council maintains that it will eventually close them, but some parents have described the situation as a shambles. Malcolm Robertson reports.
It's one of the schools in Suffolk earmarked for closure. Under a reorganisation review, Beyton was due to shut in 2013, was put back 2 years, and some believe it could be delayed a lot longer than that. Suffolk decided to streamline its educational system by doing away with middle schools, and therefore will just have primary and secondary schools. But the situation is, to say the least, confusing, with critics describing it as chaotic and a mess. And they believe that what will happen is that Suffolk, in trying to save face, will close some schools, but because of financial pressures, will abandon plans to close others. There are 3 phases, with schools in the lowest-oft area shutting next year. Beyton's in the final phase. The council says it will improve educational standards, but it's a controversial scheme that's drawn considerable protest. Andy Nicholson's the head teacher at Beyton. He says the current uncertainty makes it impossible to plan ahead.
The government at the moment are having to make some hard choices and hard decisions, and I think Suffolk are going to have to make the same hard choice and hard decisions. I think they're going to have to accept that they may end up with a little bit of egg on their faces, where they can't finish something they've started.
Recently, Bedford Borough Council scrapped plans to phase out middle schools to go to a 2-tier system. They were hoping to get the money from a government scheme, but that's now been cancelled. The council says it's furious, having already spent over £400,000 of taxpayers' money on the initial work. It's quite a patchwork of systems across our region. While Suffolk's future remains under debate, most counties now operate on a 2-tier setup, including Cambridgeshire, Essex, almost all of Norfolk and Hertfordshire, and pockets in Luton and Northampton. But in much of the rest of Northamptonshire, central Bedfordshire and Bedford Borough, there's still a 3-tier system. Saxmundham in Suffolk is due to close in 2012. Parents there say they don't know if that will go ahead and are concerned millions have been spent on what may be a wasted scheme.
But the facts are all pointing in the direction of put this on hold. Why is it on hold in West Suffolk and not here?
We're completely behind the move from 3-tier to 2-tier, but my fears are that the risk behind that isn't worth the reward.
Despite cuts in school funding and a government spending review, Suffolk's portfolio holder for education is adamant middle schools will go.
The ultimate target of getting that improvement for young people at 16 is so absolutely key to the future of this county that we have to press on with it.
So do you think in 3, 4, 5 years' time all middle schools in Suffolk will have gone?
I would like to think that we made that happen, but if we don't, we'll do it sometime in this coming decade.
Today, youngsters at Beyton were busy with a school production. The feeling among some parents in the county is that what's happening with middle schools is even more of a performance. Malcolm Robertson, Anglia News.
And the region's politicians will be talking about cuts in the school building programme in tonight's Anglia Late Edition.
Alistair Stewart will be talking to new MPs about education and